for everyone.
Okay.
I'm just putting the timer now. Al-Fatih ready?
Just a minute. I'm opening the school.
Okay. When you are ready, let me know. So you're just gonna be John. John is 73-year-old. Just follow school. And
the 3 years old man presented with rectal bleeding.
Yes, this is the scenario, Ahmed.
Okay.
Mohammed, start the recording. Yeah. So your scenario, 73-year-old man present with rectal bleeding. Just take a history from the patient and then discuss with your consultant. You have 6 minutes for the history and then 3 minutes for the discussion. You can start now.
Okay. Hello, I am Dr. Ahmed, one surgical doctor. Can I confirm your name and date of birth, please?
I am John, 73 years old.
Nice to meet you, Mr. John. Mr. John, how can I help you today?
I have some bleeding when I go to the toilet.
Oh, I am really sorry to hear that, Mr. John. Mr. John, can you tell me when did it start with you?
I think it is 2 months ago.
Okay. Did it start suddenly or gradually, Mr.
John? It is start gradually, but now it is getting worse.
I'm really sorry for hear that, Mr. John. Mr. John, can you tell me this condition? Anything makes this condition increase?
I'm not sure yet, really.
Okay. Is there any things make this condition stop?
Just if I went to the toilet, just I'm saying in the toilet, nothing else.
Okay, Mr. John. Can you tell me the exact color of this bleeding, of this blood, Mr. John?
It looks like dark red.
Okay. Can you tell me the amount of this bleeding per cup of tea or?
I'm not sure, but it is not small amount.
Okay. Mr. John, is it? Do you feel any? Do you feel any aware of your heartbeat?
Aware of what?
Of your heartbeat.
Heartbeat, yeah, sometimes, yeah.
Do you have any shortness of breath?
No.
Okay. Do you have any episode of fainting?
Episode of what? Episode of what?
Fainting.
Fainting?
Or,
no.
Yes.
Yes, but I feel tired all the time.
Okay. Mr. John, can you tell me, is there any change in bowel habit like diarrhea or constipation?
Yeah. Sometimes I feel constipation and it is altered by diarrhea.
Oh, I am really sorry for that, Mr. John. I wish you become well as soon as possible. Okay. Can you tell me where do you feel any loss of appetite?
Yeah, my appetite is very poor last 3 months.
Okay. Did you feel you lost some weight in the last period?
Yeah. Honestly, I lost about 10 kilograms in last 3 months.
I am really sorry for that, Mr. John. I wish your health become better as soon as possible.
Yeah.
Okay, Mr. John, thank you for your operation and your sharing that important information. I'm gonna ask you a further question. Okay, did you have any mucus mixed with blood?
No.
Did you feel any tummy pain while straining?
Sometimes, but like not pain, it is discomfort only.
Okay, Mr. John, is this condition okay? Sorry. If you did you feel any joint pain or back pain or skin rash?
No.
Did you take any sinus medication?
No, no,
Okay. Did you feel? Did you notice bleeding from any other side of your body?
no, not at all.
Okay, Mr. John. Did you travel to any foreign country
No,
in the last period?
no, no, no.
Okay, Mr. John. Can you tell me if you have any anal swelling or
No,
itching?
I'm good. No,
Okay, Mr. John. Mr. John, did you have any did you have did you have allergy from any medication?
no,
Any familiar medication?
no,
Did you have history of doing surgery?
no, no.
Okay. Did you have family history of colon cancer?
I don't know really.
Okay, Mr. John. Um, Mr. John, I will ask you some questions that may be confidential between us. What did you do to live?
I'm retired now.
Okay. I am really sorry for hear that, Mr. John. Mr. John, did you smoke?
I quit, but in the past, yeah, I used to smoke.
Now,
Time
many
finished.
cigarettes per
Time
day?
finished. 6 minutes finished. 6 minutes finished. Okay, doctor. We're gonna start. If you can present your patient for me, please.
Okay, I'm presenting Mr. John, 73 years old male, complaining of bleeding per rectum, increasing gradually by time, and he have no visit of fainting, or he have discomfort with straining.
Yeah.
No, he's a smoker. No other no symptoms suggest any anal condition or IBD or gastroenteritis.
All right. So what's your main diagnosis?
It is colorectal cancer.
All right. What are your differential diagnoses?
Differential diagnoses include IBD, inflammatory bowel disease, and irritable bowel syndrome, and gastroenteritis, and anal condition like anal hemorrhoid, and anal fissure. And angiodysplasia, and benign polyp.
Okay. And what is the key investigation?
I will do colonoscopy for looking for colorectal condition.
All right. You're gonna do colonoscopy.
Yes.
Anything else?
Also, I must do a blood test like CBC, complete blood count, and urea electrolyte, and liver function test. Also, I will do imaging like abdominal ultrasound and abdominal X-ray if suggestion of toxic megacolon or intestinal obstruction. Also, I will do CT abdomen for myths and for staging. Also, I will do sigmoidoscopy, proctoscopy, and sigmoidoscopy and proctoscopy.
Okay. And how would you manage this patient in a brief point?
Okay. I will start my management by doing proper clinical abdominal examination and digital rectal examination, and then I will share this information with the multidisciplinary team to see if this patient is operable or not operable. If operable, I will do Hartmann procedure with end colostomy, and if not operable, I will do palliative management.
Fine. And if not operable, what you gonna do?
If operable,
Time up.
If not operable, it still has 6 seconds or 10 seconds.
What?
If not operable, what you gonna do?
I will do palliative management for this patient.
All right. And what is Hartmann procedure? Time is finished, but finish your question.
Hartmann procedure is doing colorectal resection and rectum stump rectal stump and
fine. Resection of the rectosigmoid with closure of rectal stump and formation of colostomy. As I made a short video on YouTube on it. I'm not sure if you watched it, but I made a quick short video about Hartmann procedure. Okay, fine. So we finished within the time. Let me start with the feedback, Muhammad, and then I will give you the feedback. Muhammad will give you the feedback after me. You introduced yourself. You took permission. You get your patient name right. You mentioned the patient name multiple times. You've been sympathetic. That's all good points. When we mention this, Ahmed, we're just gonna mention the bad stuff, the negative point for you. So don't get disencouraged. Okay? We're just telling you what did you miss, but we don't mention exactly what you mentioned. A lot of points. We're not gonna mention them, but we'll let you know what did you miss so you can improve on the next session. Okay. You said I'm one of the surgical doctors. I just want to confirm this for everyone. We never say I'm one of the exam candidate. We're simulating the exam. That's why we say I'm one of the surgical doctors. Don't say I'm one of the exam candidate, as you already did. You said I'm really sorry. I'm not sure, but the way you pronounce sorry need improvement. I'm really sorry. Can you say that for me? Can you say it? Can you repeat it?
I'm really sorry.
Yes, I'm really sorry to hear that. We're gonna upload this recording later on. I want everyone to hear himself. Like you have to review your recording so you will improve on it. Does that make sense? When I was practicing, I used to put a camera and record myself. When you record yourself, you will see the bits and falls. You will see the details. What did you miss? Mr. John, can you tell me when it started with you? That's a long sentence. You have no time for that. You are not able to finish all your history because you are saying a lot of long sentences. Whenever the time attack you and you have a short of time, you have to be quick and say short sentence. Okay? Can you tell me, Mr. John, when this bleeding started? That's it. You don't need to make it complicated. Your face, that's why we ask everyone to open the camera. From now on, when you practice, give it a smile. Treat me like I'm here. Okay? We want to mimic the exam like the exam. That's why we put 6 minutes, and that's why we put 3 minutes for the discussion. We want it like the exam. So when you talk to me like a patient. Okay? You didn't smile throughout the session because obviously you are stressed, but we need to break this before your exam. You should give it multiple smiles. Are you aware of your heartbeat? This question was difficult for you, and you asked me, just are you aware of your heartbeat? You said, I think, did you feel your heartbeat or something like that? Can you tell me when do you feel loss of appetite? Instead of all this long sentence, any loss of appetite, Mr. John? Like this? Mr. John, any loss of appetite? You don't need to make it complicated. Look, Ahmed, every 10 seconds, like every second you need it. You didn't ask about the systemic review, you didn't ask about eyes. I'm not sure if you asked about the family history, which is very important. The social history is smoking. You have no time to waste. It's just 6 minutes. That's all what you've got. Instead of, can you tell me more about any... No. Mr. John, any loss of appetite? I'm finished. when you started your differential in the history, you start with the most important differential, which is colorectal cancer. I think you started with irritable bowel syndrome or something like that. When you're asking about the weight loss, the question, you should follow the scenario of excluding the most important differential first, which is colorectal cancer here. After you finish the colorectal cancer, then you go to the next, and then the next. Colorectal cancer, then inflammatory bowel disease, then infective cause, then bleeding tendency. Okay? So you have to follow the importance of the differential. Did you take any thinners medication? It's not did you take, it's are you taking? Are you taking? It's not like if he took it like 1 year ago, is that relevant to you now? If he was taking blood thinner 2 years ago and stopped 6 months ago, is it relevant?
No.
No. But you are asking about, are you taking blood thinners now, Mr. John? Okay. You didn't ask about vomiting and tummy pain in the gastroenteritis. You should ask about that to exclude one.
Yes.
Yes.
He asked about the tummy pain.
Yes.
Yeah, but not the vomiting.
Yeah, not the vomiting. Yeah.
Yes. When you presented your patient, you said, I want to present Mr. John, 73-year-old. You said you should say complaining of his present symbol. His complaining.
Network, I think.
Yeah, can you hear me now, Al-Fatih?
Yeah.
Ahmed, can you hear me?
No. I cannot hear you.
Is it fine now? Maybe you can take your headphones if you want. But if everyone is hearing me fine except you, I think it's
it's good.
Just
yeah. So are you Mr. John presented complaining of when I asked you what's your differential diagnosis, Ahmed Soujo, he's back. When I ask you what's your differential diagnosis, you should start with the most important differential diagnosis, as we mentioned in the school. I think you mentioned colon cancer, and then you mentioned IBS, irritable bowel syndrome. Irritable bowel syndrome is in the bottom of the list. You shouldn't start with it. Okay? So whenever your examiner asks you what's your differential diagnosis, you should give the differential diagnosis according to the importance. And while you are presenting, firstly, everyone here, you need to present your patient, because the first interaction between you and your examiner is when you present your patient. And this exam is about the first impression. This exam is not about your knowledge, it's about how you present yourself. So whenever you are practicing a history, you have to practice how to present your patient. This is very important. So when you're presenting your patient, if you forgot the name or the age, just make up any name or any age. Or you can say, I took a clinical history from this gentleman, or I took a clinical history from this lady who presented with da. In your investigation, you said colonoscopy, but you didn't mention biopsy, Ahmed. It's very important. Yes. You should say colonoscopy plus biopsy. There's no doubt about that. And when I ask you about your imaging, you said CT abdomen and pelvis. You said CT abdomen, you didn't say pelvis. So you're doing the CT abdomen, and you're doing CT, we call it CT-AB. CT abdomen and B for pelvis, CT-AB. Abdomen and pelvis for metastasis and for staging. Okay? So if you ask me now, I will say, if this station is from 20, you will get around 13 to 14 out of 20.
Not bad.
Not bad, but we have a long journey to improve, okay?
Good.
Inshallah.
Okay. Yes, this is most of my point. If anyone has any point, you can drop in the comment. I will leave it for Muhammad now.
Okay, nice presentation, Ahmed. I think Ali attacks you in details, but you will benefit from these details, and you will improve by time.
Can I just say one thing, Ahmed? I want you to see me here. Look, is you know, in our religion we don't say this is halal, 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 right? Because everything is halal except what is already haram, right? So when I attack you by mentioning what you missed.
Yes.
But I won't tell you ask about the pain. I won't say you ask about the fever. I won't say you ask about this, you ask about that, because you already did it.
Yes.
Yeah, so don't get disencouraged. Yeah, Muhammad.
Okay, I think Ali mentioned all the points. Just I have 6 quick points. Ahmed, you should start by an open question. When Al-Fatih said to you, I have bleeding from my rectum or by rectum, you should say, tell me more about it. Don't start by an open and end question. When did it start? Tell me more, because this will increase your marks of professionalism. And the second point, I think you thank the patient during your station or your history taking. This took from you 30 seconds that can be used for eyes. Okay? You don't need to thank the patients for during your stations, just for showing empathy while patient answer. The third point, don't ask double question, Ahmed. I think you said to Fatih, did you experience any joint pain or rash? Make it separately. Did you experience any joint pain? Then any rash. Okay?
Yes.
Regarding the discussion, you can make your discussion or your presentation very easy by mentioning the patient name and age. And if you forget to mention the patient name and age, just say, I took clinical history from this gentleman, then mention the main complaint, then 2 to 3 points regarding the main complaint, then the signs that support your main differential diagnosis, and jump immediately. So my main differential diagnosis is blah, blah, blah. And the other differential diagnosis I will consider is blah, blah, blah. Don't let the examiner ask you what is your main differential diagnosis, which you will took 30 seconds, and then ask you what is the other differential diagnosis. Say all that, okay? The last thing in professionalism, when Ali asks you about the investigation, you should start by saying, after taking this full history, I will start by doing full clinical abdominal examination. Okay? Then
I think he said it, Muhammad. He said it.
If he forget to say examination.
Okay. Yeah. It's when I asked him how to manage the patient, he said it. Yes, I remember now.
Then divide your investigation into blood investigation, which is lab, imaging, lab, and stool analysis. Otherwise, I have no any point. Very nice presentation, Ahmed. You will improve by time.
All right. Okay, let's move to the next station. Fath Rahman, he pressed on the link, but I think the link was invalid, but he's with us now.
Hi, Rahman.
The next station, I think,
is
it's all recorded. It's all recorded, Fath Rahman. We're just gonna upload this. Everyone will see it. The next, let me just look to the group, Muhammad. Give me 1 second.
Okay.
Al-Fatih Seizure and Hassan Asim Pseudoaneurysm. I'm not sure if Hassan Asim is here. Hassan Asim already on duty.
Anyone
so
able?
I don't think he will be.
Yeah.
Yeah, we can do the Fath Rahman, can you do the Pseudoaneurysm?
It's okay, no problem. Hi,
Okay.
Assalamu alaikum.
Okay, pseudoaneurysm, and then we have seizures.
So Fath Rahman, the scenario is a 45 years old man is referred by his GB with growing lumps, suspected growing abscess. Okay, you have 6 minutes to take the focus history and 3 minutes for discussion. Ahmed, can you be the patient for Fath Rahman?
Oh, okay.
Just follow school.
Yes. Okay.
Yes.
Those
who didn't practice today, like Al-Fatih, you're gonna practice tomorrow. All right. So we're just gonna.
Ali?
Those who didn't practice today, they're gonna practice tomorrow. We're just gonna alternate.
It will be on a cycle.
We'll make it fair for everyone. Yes. But by being patient, that's very important. Okay, fine. Ala is also here, so she can be the patient for the next station and this one. Ahmed is here. So Ahmed, you are the patient.
Okay.
Just open school and answer according to the school. Fatah Rahman, I don't want you to read from school. Just use your head, okay?
Sure.
Okay, let me with the time
Yes.
about 6 minutes.
It's growing up. Or
Yeah.
yeah. Okay.
Affected pseudaneurysm,
A
yes.
45-year-old man is referred by his GP with growing lump. He referred the suspected growing abscess, but when you take the history from the patient, you're going to discover it's not a growing abscess. Okay?
Okay.
Okay, let's start.
Okay, 6 minutes started.
Good evening.
Hello. Yes.
Hello. Yes. Good evening.
Hello. Hello, doctor.
Yes, I'm Dr. Fatah Rahman, one of the surgical doctor working here. May I confirm your name and age, please?
My name is John, 45 years old.
Nice to meet you, Mr. John. How I can help you today, Mr. John?
I have got this lump in my left side.
Sorry to hear that. Is it start gradually or sudden?
It starts suddenly.
When you notice it growing swelling?
5 days ago.
Okay. Is it in increasing size or static size? Hello?
It is, أيوة.
Answer from your head, that's fine. You don't need to follow school.
Okay. It is increase in size.
Okay. Is there any pain in this area?
Yes, there's pain.
Sorry, before that, on which side? Left side or right side?
I tell you, doctor, before.
Sorry, I'm double checking also.
Huh?
Do you have any trauma at that side?
No.
Is any swelling at any area?
No.
Any skin change?
Yes.
Do you have any fever?
Yes.
Is this swelling you have a pulse? Is pulsatile or?
No, I didn't think that.
Okay. Do you have any abdominal pain or tummy pain? Sorry.
No.
I'm just going to carry on the session. I will continue the patient, Ahmed. Is that okay?
Okay.
Yeah, doctor. Yeah, it's versatile, doctor. Yes.
Do you notice is this swelling going or disappear during lying down?
No, it's consistent all the time, doctor. It's all the same.
All the time. Okay.
Yeah.
And you mentioned you don't have a fever.
I have some fevers, but this disappeared yesterday. Yes. Yeah, doctor, I'm with you.
Yes.
So let me tell you, doctor. To be honest, I'm a bit worried about this abscess. My GP said it's abscess, and he said I should come here. So it's pulsatile, as I said, and there's some blood coming out of it. So I wish you, yeah.
Do you have noticed any pain in the lower leg or any paleness?
Yeah. Sometimes I will have some pain while I'm walking. Yes.
Do you have any chronic illness, Mr. John?
No, but I'm just gonna be honest with you, doctor. I use some heroin. I used to inject myself with some heroin. I'm just gonna be very clear from the start.
Thank you, Mr. John, for sharing this information. It's very important.
Yeah.
So a little bit confusing.
Yeah, it's okay.
That's all right. I think I answered every question you asked me. So if you still have 2 minutes, I'm the examiner now. You still have 2 minutes, so you can just do whatever you like.
Do you have taking any medication?
I don't take medication besides the heroin I used to inject. That's all.
Okay.
Yeah.
What is your job, please?
I'm unemployed, unfortunately, doctor.
Sorry for that. There's any patient, any other family member have similar complaint?
My dad had heart attack when he was 50, but I'm not sure if this is relevant to you or not.
Sorry for hearing that.
Yeah.
Do you have any headache, Mr. Ali?
I don't have headache, no.
Any chest pain or shortness of breath?
No short pain, no short pain.
Do you have tummy pain?
No, I don't have tummy pain, no.
Do you notice unintentional weight loss, Mr. John?
I lose weight, but because I don't eat much, that's all. I lost weight, but because I don't eat much, yeah.
Before concluding, Mr. John, do you have any concern or idea about what's the problem for you?
To be honest, I'm not convinced enough that my doctor said this is an abscess. That's why I asked him to refer me to the hospital. I don't think this is just abscess. As you can see, this mass is moving upside and down. And from what I remember, the abscess doesn't move. So that's why I'm here.
Sure, Mr. John. You are carry on your condition, and you are in safe hand. We hope we'll help you and fix it.
Yeah, that's all right.
Okay. Thank you, Mr. John. So
okay, the time is already finished now. I'm just gonna put at Muhammad. Can you put 3 minutes, please?
Yeah. 3 minutes started.
Present your patient, doctor.
I took a clinical history from Mr. John, who is referred from GB as left groin abscess. It started 5 days ago. It started suddenly, static size, pulsatile with blood discharge. He's unemployed and he's drug abuser, injecting himself. He has medically free with a family history of heart attack of his father.
All right. So from what you're saying, what's your main diagnosis, doctor? What do you think?
My main diagnosis is infected pseudoaneurysm, but I will consider femoral hernia, inguinal hernia, lymph node, infected or non-infected growing lymph nodes.
Okay. Anything else?
Abscess, growing abscess. I will consider also growing abscess.
Okay. And how are you gonna approach the investigation for this gentleman?
After doing clinical examination, including abdominal and growing examination, I will order blood and imaging. For blood, I will do CBC, complete blood count, and looking for WBC, a sign of infections. I will consider ERCB and C-reactive proteins, liver and function test, coagulation profile, in case I will go for surgery. Also, I will order Doppler ultrasound with compression and injection of thrombin. This is
okay. So you said Doppler ultrasound. Do you have any other imaging you want to mention?
CT angio.
CT angio. Okay. What is your management plan? I think you already mentioned one of them, but give me your approach for the management.
As I mentioned, I will start with ultrasound compression and injection of thrombin. Also, I will consider ligation of the femoral artery with revascularization.
Okay, and do you have anything else you want to give your patient?
I will give an antibiotic or cause infection. Yes.
Okay. Okay. You said the surgical ligation of the femoral artery. Any other operation beside the surgical ligation of the femoral artery?
Delay revascularization. Delay.
Okay, if needed. Okay, so can you define the true aneurysm for me? What is aneurysm?
Is a dilatation of the blood vessels more than 1.5 of the normal diameter, including the whole.
But continue your answering.
Yeah.
Sorry?
3 minutes finished, but continue your answer.
I don't know.
3 minutes finished, but finish your answer. Yeah.
Okay.
Yeah.
The true aneurysm, as I mentioned, is a dilatation of the blood vessels more than 1.5 of the original diameter, including the whole layers of the blood vessels.
Okay, and what is the pseudoaneurysm?
Pseudoaneurysm is dilatation of the blood vessels, including only the outer two layers, and not involved with the ciliary. It will be tonic media and tonic advantage.
Okay. All right. Good. Good, Al-Fatih. Good, Fatah Rahman. Look. Because we are here for all of you guys to pass the exam. So I want you to feel familiar when you're coming here.
Okay. Sure.
So nobody here to judge, nobody to say your presentation. You got stressed for whatever reason. At the start.
Sure.
Your answer is an answer of experienced surgeon who knows what he's doing. There's difference between the presentation and the discussion and your history. You did very good in the presentation. Very good in the presentation. But in the history, you forgot a lot of stuff. You were panicking. Okay? So I'm gonna reassure you that's normal. My first presentation is, I couldn't even remember what did I say. And this even could happen to the exam. If you, let's judge your presentation now. I will give you around 13 or 12 out of 20, but you didn't fail the station. This will depend according to the rest of the examiner, the candidate, and how did they perform. Mm-hmm. Your performance could be better than other people. And it has a curve to it. You did very good in the discussion, which may eliminate your first
history divisions, yes.
Yes. And as I said, this exam is about impression. My impression about you now is you are a safe doctor or a safe surgeon who got panicked. And this is normal. You're going to practice with us and you're going to master this. You forgot multiple points, but I'm just going to carry through the history just to make sure you understand. You should present yourself, take permission. You did that right. You asked about the main complaint of your patient. At the start, I think also because Ahmed said I have the mass is not versatile, this confused you. I think also that's contribute to you being, So it was a versatile with fever. I think that's also a cause. You didn't ask about all the differential diagnosis and all the questions. You should ask about the effective femoral pseudoaneurysm. You should ask about the growing abscess, lymph node. You asked about the weight loss, but you were very disorganized. You asked about it later. You didn't ask about the night sweat or the appetite. You asked about when you lay down, but you didn't ask about it in the inguinal hernia section, like what prepared in the school. You didn't ask. You asked about the past medical history, but as I said, it was also disorganized. You didn't ask about the allergy. Your patient most appropriately will have penicillin allergy, which you need to avoid while you treat your patient. You asked about the social history also, but it was very disorganized. You asked about it earlier, and you stopped for a couple of seconds here and there.
Yes.
Yeah, which is not appropriate. You presented your patient right. You presented your differential right. You did your blood investigation. You mentioned the operation. You forgot analgesia and IV antibiotic. I needed to push you to remember the analgesia and the antibiotic. And it's not a complicated station. It's very station. You should easily pass it. If you just focus on don't panic, you've been doing this for a lot of time. Consider it as a patient. And I give this advice for every single one. Whenever you're going to the exam, speak with yourself. there's two choices. Either I pass or I fail. If I pass, that's all right. If I fail, I'm going to take it again. And if you are already working and you have your job, MRCS is not at the end of the world. Does that make sense?
Yes,
I
sure.
think you are every surgeon is type A personality. We are anxious people. That's normal. You shouldn't be anxious. If MRCS is not your life, you can pass and that's fine. Or if you didn't pass, you're gonna take it again. What's gonna happen? Nothing. You're not gonna die. You're gonna continue your job. Fine. I just want to make sure, Mohammed, when you are going through your points, if you can just share the screen and explain the image that's in the school. I think that will be helpful. But you answered the discussion question in a good way. Okay? Watch this recording later on so you understand what did you do wrong.
Okay,
Mohammed.
before that, Fatah Rahman, very nice. Just let me start by the positive thing. When Al-Fatih say you asked this question previously, you said I would like to double check. I'm really sorry. Perfect. I will mention the professionalism, the points about professionalism, and start by an open question, Al-Fatih. Don't jump immediately to when did it start. Could you tell me more about this lump? Okay.
Sure.
And I am so glad that you asked about the concern and you reassured your patient in very nice way. The last thing regarding discussion, Al-Fatih, mention the positive thing that enhance your main differential diagnosis. You should say this this lump is pulsatile. Okay, I think you forget this. And I am so glad also you mentioned that I will start by full clinical examination. The last point regarding CT angiograph. To take the full mark of professionalism, you should not say just CT angiograph. CT angiograph for the pelvis and the lower limbs. Otherwise, I have no any point. And also, I notice you, Al-Fatih, you are remembering the differential diagnosis while asking the patient. So take it, if you forget to ask about the differential diagnosis, there are three things called MTI. M for malignancy, T for trauma, I for infection. Don't forget to ask about this if you forget the differential diagnosis.
MTI, okay.
Malignancy, trauma, and infection. Otherwise, I have no any point. Very nice presentation. You will improve by time, inshallah.
Thank you.
Okay.
I want to add one thing quickly. So whenever you find yourself blank and you don't know what to say, instead of just sitting, ask about anything. Anything. So instead of you sitting and in awkward moment, you can ask about your patient about family history, social history, whatever comes to your mind, ask about it. Okay?
Okay.
Yeah. Fine. That's all right. Let's go to the next.
Thank you.
Okay. The last station is Seizure, who is Al-Fatih.
Yes, Al-Fatih, and I will. Ala, but I don't. Ala, I don't think she has a full access to school at the moment yet. She didn't sign up. Ala.
Yes.
No.
So let Al-Fatih, let Fatah Rahman be the patient for Ala, for Al-Fatih.
Seizure is Al-Fatih by. Yes, let's put Abdurrahman. Fatah Rahman is going to be the patient. All right.
Okay.
Sure.
Open the Seizure from the school Fatah Rahman and take a quick look.
We wanted to make you the patient, but I don't think you have access to school for the seizure.
Okay, I will try. I can be the patient for seizure.
Okay, fine. So take it to the toward epilepsy. All right. Take the history. Make it epilepsy, but the patient has brain cancer recently. Does that make sense?
Yes.
Already known of the epilepsy, and he developed cancer. Yes.
All right. So Ala, you can be the patient, and Al-Fatih, you are the doctor. I'm just gonna put the timer now. Seizure. It's a very complicated station. I hope none of you have it on the exam. Okay, let's start. 6 minutes.
Good morning. I'm Dr. Al-Fatih Ahmed. one of the surgical doctor here today. Could you please confirm your name and age, please?
My name is Ala. I'm 66 years old.
Great to see you, Miss Ala.
Great to see you too.
Today, I'm going to ask you some question about your condition. Is that okay with you?
Yes, okay.
Okay. So, Miss Ala, how can I help you today?
Recently, for the past 3 years, for the past 3 months, I feel like I having seizure.
What do you mean by seizure, please? Can you make
I lost. Suddenly I fall down and start my hands and all my body shaking, and I'm lost of my conscience.
I'm so sorry to hear that, Miss Ala. What were you doing at that time?
I was reading at night from my laptop.
I'm so sorry for that. Is there any witness at that time?
Witness?
Yeah, someone attend your episode.
Yeah, my husband.
Did he describe for you what is happened? Did you?
Actually, he take a video for that.
Okay. And did you lose your consciousness? Lost your consciousness?
Yes.
Sorry. And did you wet your pants or your clothes?
Yes.
And did you bite your tongue?
Yeah. Yes.
Yeah. And did you fall down?
Actually, yes. I was sitting and then I fall down in the floor.
Did you hurt your head or any part of your body?
Yes. Mild trauma in my head.
I'm so sorry for that. Did you need any painkiller now?
No, it was mild.
Okay. And you said you lose your consciousness. For how long did you lose it?
Actually, I was not aware about how many minutes that I lost my consciousness, but according to my husband, he said about 10 minutes.
Yeah. Yes, Miss Ala, is this the first time to have this episode or you had it before?
No, actually, this is the second time, which make me very worried.
It is similar like this time or different?
It is no, it's similar, but the time increased. Previously was 7 minutes and now 10 minutes.
Okay, I see. Do you notice any weight loss recently?
Yeah, I think so. Yeah, my clothes become so wide, so loose.
So how many kilo you lost at this time?
Around for this 3 months for 20 pounds, 20 kilogram.
Oh, I'm so sorry to hear that, Miss Ala. Did you notice any change in your appetite?
Yeah, I lost appetite recently.
Did you notice any headache?
Yeah, I have headache. Actually, is after seizure.
Yeah. So, do you have any blaring, any abnormal vision?
Yeah, I have blurred vision.
And do you have any weakness in your arm or your leg?
No, I don't feel weakness on my leg.
Okay. To go further, Miss Ala, do you have any fever?
No.
Any stiffness in your neck?
No.
Have you had any trauma in your head recently?
No.
Apart from today?
No.
Okay. Do you have any surgery in your head?
No.
Okay. And I'm going to ask you some question about your medical background. Do you have been diagnosed with any chronic disease?
No.
Do you have been diagnosed with have someone told you this is epilepsy or not?
No, actually, this is the first time I went to visit doctor to see medical advice.
Okay. And do you have been using any drug?
No, actually, just when I feel like headache, I just only Panadol.
Okay. For your family, is there anyone has this episode?
No.
You aware of that?
No.
Okay. Miss Ala, I'm going to ask you some question about your social history. So I would like to ask you some personal question. Is that okay?
Yes.
What are you doing to live, Miss Ala?
I'm retired.
Retired. Okay. Do you drink alcohol?
Yeah, sometimes.
Okay. And do you smoke?
No.
Okay, fine. Miss Ala, what is your idea about this? Can be called this episode?
Time finished.
Okay.
3 minutes. Muhammad, start the discussion, please. Or I can start the discussion from here.
Okay. Let me put the 3 minutes, Ali.
Yeah.
3 minutes started.
Okay. Can you present your patient, doctor, please?
I'm going to present Miss Ala, 56 years old, which has recent episode of abnormal movement in her arm, and with loss of consciousness. This is documented by witness, her husband. She had associated with sphincteric disturbance. Also, the patient, Miss Ala, is experienced weight loss about 20 kilogram in last 3 months, which was unintentional. So my main diagnosis is epilepsy, but I would consider brain tumor.
All right. And what's your differential diagnosis, please?
Brain tumor, metabolic cause like hyper and hypoglycemia, and electrolyte disbalance, or myoclonus, or dyskinesia.
All right. Any other differential?
I would consider infection like encephalitis.
Okay.
And also hypocalcemia, hypomagnesemia.
All the electrolyte disturbance.
Yeah.
The metabolic and toxic causes. Okay. Do you have any psychogenic causes? Psychological one? All right. Okay. What red flag did you identify during your history?
Yes, the weight loss with unintentional weight loss for last 3 months for 20 kilograms.
What else?
And also the patient experienced headache also.
Okay, and the seizure itself. All right. What investigation would you arrange for this lady?
I will start by simple investigation, blood test for full blood count and sugar level. And also I will go for urea and electrolyte. And then I will go for EEG and MRI.
All right. What else?
Also, so I can do inflammatory marker, ERCB, inflammatory marker, ESR and CRB, and calcium.
You said MRI. You said also CT brain. Is it with contrast or without contrast?
For MRI, I will go with contrast.
For the CT,
time up, but continue the question, Ali.
For the CT, I mean.
CT with contrast. CT non-contrast.
Non-contrast. Okay, fine. Okay, so I will ask you to manage this patient, but for now, give me the plan of management, the general management plan, and also then I want the plan of management for status epilepticus.
Okay, general plan is in the Seizure itself. Puts the patient in space, in safe space, and monitoring and just wait. and then prescribe anti-convulsant medication for a long time. For the seizure itself, I will give her benzodiazepine to prevent further seizure, and then describe oral anticonvulsant for long time, like phenytoin, carbamazepine, phenobarbital, valproic acid.
Valproic acid, okay. And can you define status epilepticus for me first?
The duration of seizure for more than 30 minutes.
All right. And can you give me the treatment for status epilepticus?
Status epilepticus start with ABC. Then I will start with airway and give oxygen, and then IV line, and then I will start with benzodiazepine or lorazepam and phenytoin. I'm not remember the dose. Phenytoin, and will also phenytoin and diazepam.
Okay. So what is the definitive treatment for this lady if the imaging confirms a brain tumor?
For debunking by gamma knife, surgical. Debunking by
surgical resection after MDT discussion.
Okay.
All right. Okay, good. Very good, Al-Fatih. That's a very good history. Seizure is very complicated. Thank you, Ala, also. That's a good presentation. You did a good job, both of you.
I would like
yeah, so I think you said it wrong, Al-Fatih, but you should say, I'm not going to say what you said, what's the positive point. I'm just going to say the negative point, as you know.
Okay.
For now.
Okay.
Yeah. You should say, is there any witness? You said, is there any witness? You shouldn't say, is there any witness? Because that's a present symbol. You should say, was there any witness? Was there?
Okay.
So there's a lot of people with different courses. They say grammar is not important. I don't want you to listen to them, especially if your exam is in UK. Because look at it. Imagine your examiner is a British, okay? And his mother language is English. And you came with a grammatical error. Just like me coming to you, imagine all of you. عيان هذا ذهب تعبان. عيان هذا صداع كثير. Do you accept this?
No.
So for everyone says grammar is not important, tell him to shut up. Especially if your examiner is British. And you may have a British examiner internationally, and you may have a British examiner in UK. Your examiner could be a fluent speaker or could be speaking English as a first language. You should practice the grammar and you should make your grammar very well.
Okay.
So it's not if there any witness, it's was there any witness. You said, did you lose? That's wrong. Did you lose?
Lose, yeah.
Not lost. Listen to yourself later on.
Okay.
You said did you lose multiple times? And you said did you fail? Did you fall? And do you need? You said did you need any painkiller? You're talking to her now. You said did you? Yeah.
Did you?
It's all recorded. That's why I record. Because whenever I have session with a student, I didn't say that. I mentioned that. It's all you review the recording and tell me if I'm wrong. For how long did you lose? Also, you said. For how long did you lose? You said for how long did you lose? You should say for how long did you lose? You said also, do you have been diagnosed? Do you have been have you been diagnosed? You are muted. Have you been diagnosed? Have you been diagnosed? It's not do you have been diagnosed. I can't hear you. You are muted. Okay, fine. So do you have been diagnosed is wrong. You said it like 3 times. It's have you been diagnosed? During the presentation, when you presented your patient, you can use medical term. You can say seizure. Instead of saying this lady presented with fitness or uncontrolled movement, because you are talking to a consultant now. Whenever you are talking to the patient, avoid medical jargon. But when you are talking to your consultant, you can mention medical terms. Do you hear me, Al-Fatih?
Repeat this negative point, please, Ali.
Sorry?
Repeat this again, because your voice was not clear.
Okay. Whenever you're speaking to your patient, you shouldn't use medical jargons.
Yeah.
But when you are presenting to your consultant in the presentation, you can use the medical terms. When you presented your patient, you said this patient presented with uncontrolled fitness or something like that. You can say presented with seizure.
Okay.
The word seizure is you can use it, yes.
Okay.
Me and every single Sudanese doesn't pronounce level right. We say level. All of us, you, me, Muhammad, everyone say level, but it's level instead of level. And during your treatment, you should say, I would put my patient in the recovery position. This is very important. Recovery position. And after you finish this, I want you to go back to school and to try to memorize the dose for the medications. Okay? For the antiepileptic. It's very organized. You can just remember the levetiracetam and valproic sodium 40 milligram per kilogram IV up to 300 milligram over 10 minutes. Just remember, review the doses. But overall, I will give you 15 out of 20 for a very difficult station. There's some improvement, as I said. I don't want you to repeat these mistakes again. That like, did you lose? That's wrong. Did you lose? I mean, that's wrong. But did you lose? That's right. And then make sure you see it from school.
So the mistake today is grammatical mistake. And,
most of them, yes. Yeah. Most of them.
Okay.
And you forgot the recovery position, which is very important for seizure.
Okay.
Yeah.
Al-Fatih, very nice presentation. I think Ali covered all the points, just 2 to 3 points in quick way. So Al-Fatih, why you didn't start by an open question? I say this a couple of times. You should ask the patient, tell me more about this episode.
Yeah, I said I started. I remember I started by how can I help me? How can I help?
Yeah, and she said seizure. You said what is a seizure? What do you mean by seizure? And then you said when did you start noting this? I think.
Okay.
But you should start by an open question. And when you asked about the alcohol consumption, she said occasionally or sometimes you should ask how many units per day per week. Okay.
English Al-Fatih.
Yeah, Al-Fatih. Yeah,
English.
she didn't say occasionally, sometimes, but maybe she didn't know what sometimes mean. It could be 5, 10 to her.
Okay.
Okay. Otherwise,
I will give.
Yeah, the last point, Ali. Sorry. You said I can't remember. While Ali asking you, you should not say not remember, because this will give a bad impression on you. If the examiner is not focused on you, you will focus on you by this sentence, not remember. You say,
okay.
Can you skip this question and come back later?
Okay.
Yes, just like that. Yes. Okay. Can we just get to this question?
Otherwise,
later
very nice presentation. You will improve by time, inshallah.
No, yeah, yes, and that's a very good presentation for all of you guys. Everyone did a good job. The timetable is ready for you for tomorrow. Just those who practice today, give priority for those who didn't practice with us. And I think everyone practiced except Hassan because he's not here. Yes, yeah, that's a very good point.
Yeah. I wrote it, Ali, which is smile and light. You should ask about the pre-aura. Did you notice any change in your smelling, or you see anything unusual? Yeah, very nice point.
Al-Fatih.
Yeah. I didn't ask. Yeah.
Yeah, this look for the seizure in the whole history. The think about seizure like this: the pre and the intra and post ictal. That's all what you need. That's very important. What happened before, what happened during, and what happened after the seizure.
Yes.
Okay.
Yeah. Yes.
That's a very important analysis.
Yeah,
I thought you
because
already asked about all of these. I think
no.
he asked about them, but not in details, Muhammad, right?
Yeah. Ala mentioned his husband record him, but you should ask her,
Okay.
can you describe or how he described it? Or you can
And
watch
what
the
happened?
video. Yeah.
Yes. Did you have any headache or floaters or any abnormal feeling
Yes.
before the
Used to
seizure?
ask about pre-ictal and post-ictal together. Yeah.
Pre and intra and post ictal. This is very important in the seizure history.
I think I missed the pre-ictal and post.
Yes. So, okay, very good. I think that's a very good session. We're going to upload the recording for all of you on the same day. You can just go to school, go to July, and then in July, you open Saturday, which is today, 10th of May. Yes, tell
If
me.
in history I want to ask some question and I forget it.
Yeah.
It's better to ask any question in any time or try to see to say some specific
Okay,
question.
fine.
Yes, for the patient.
Okay, this will depend on the question you forgot. Okay, if you forgot eyes, for example, idea, concern, and expectation, and you still have family history and social history you need to ask, there's no need to
Mm,
go to eyes.
mm,
But if you forgot one of the very important differential diagnoses, let's say you forgot blood thinners in rectal bleeding, and you
mm,
didn't ask about blood thinner in rectal bleeding, don't say,
mm,
yeah, I forgot this question. Let me ask. No. Let's say you ask about systemic review, right? You ask any headache, any abdominal pain, any da.
mm,
During your presentation, during your asking the question, and by the way, Mr. John, do you take any blood thinners? Does that make
mm,
sense? Don't
Ali,
make it obvious to everyone that you forgot and you need to get back. Because when I teach a lot of people, we have people who are
mm,
taking the May exam. Some student will come and say, I forgot this question, Mr. John. I'm really sorry. Let me ask you. Don't say that. You don't have the
mm,
time, and you don't want to, and you don't want to make the bad impression for the examiner.
mm,
Let's say, as I said, you forgot the rectal bleeding, the blood thinners, and you are asking about the family history. Okay, Mr. John. Anyone in your family have similar symptoms of bleeding by rectum? No, doctor. Oh, by the way, Mr. John, tell me, do you take any blood thinners? Does
mm.
that make sense?
Okay.
And there's no way for you to learn this skill unless you practice.
yes, Ali,
Mm,
and also his point regarding if he forget to ask questions during this
Yeah.
time, is it fine to show empathy or remembering the questions? This is his point. Am I right, Ahmed?
Yes.
Yeah.
What do you mean, Muhammad?
If you forget to ask questions, as Ali said, is it vital questions? You should start
Mm,
remembering the question. If it is
mm,
not, you should show empathy.
mm.
Okay.
So if you forgot eyes, you just say thank you, and this will cover your professional skills. But if you forgot a
Mm,
very important question, just ask it casually. Don't make it a big
mm.
scene. Don't make a drama out of it.
Okay.
Okay. Fine. Okay. Okay. We're gonna meet tomorrow then, same time. The recording will be uploaded. All right.
Mr.
Yeah.
Ali,
Yes.
is any question is important in history?
Look, we're trying our
Mm,
best to put every single question. All right.
mm, okay.
But there's no way you're gonna ask about every single question.
Mm,
That's why you should focus about the skills of introducing yourself, be sympathetic to the patient, and like it's more about the skill, not about remembering every single station, every single
mm,
question.
mm,
For example, we discussed rectal bleeding. If you asked about colon cancer, you ask about weight loss, you ask about constipation, you ask about appetite, all right? And you forget one or two questions. You already excluded colon cancer or included in your question. Does that make sense?
Yes,
So you
yes.
just look, your examiner has no material. He doesn't use a school. He doesn't use any of the PDF. They don't know about the other course provider. They don't know about them.
Yes.
They just want to feel that you are a good clinician who knows how to differentiate.
Okay.
So any resource you use, you stick to our school because we're putting every single important question and we're omitting some of the nonsense question. There are some resources has more question, but it's nonsense. There's no need to ask this question and you have no time for that. The idea is you just want to present yourself as a good clinician. That's all.
Okay.
That's the bigger picture. Do you understand?
Yes.
Yes, yes.
All right. Any other question?
No, thank you.
All
Bye,
right.
everyone.
So see you tomorrow.
Okay. Thank you.
Thank you.